Way to grow out hair? Would PRP treatments work? Am I too young? I am a 20-year-old female. I've had this hairline for as long as I can remember. My hair is not falling out. I have a full head of hair. It's just on the sides that it's like this. There are baby hairs there, but they will not grow. I have heard of PRP treatments and was wondering if it might work for my situation. I don't want to get surgery. This is something I have wanted to change for a while. Also, am I too young for PRP treatments? And will they last forever, or will I have to continue the treatments?
Thank you for your question. You submitted a question with two photos, and you're asking at the age of 20 about your concerns about your frontal and temporal hairlines, and you're describing a situation where there are a lot of fine hairs that just don't get thicker. And so, and you state that you're not experiencing hair loss, but you'd like to see if you can get them thicker, and you want to know, can you use PRP, and is this permanent? Well, I can certainly share with you guidance that I would offer to a person like yourself if they were to come to our office. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I'm also the founder of TrichoStem Hair Regeneration Centers. This is a system we developed to treat male and female pattern hair loss for using a non-surgical approach and applying PRP and an acellular matrix, which I'll describe in more detail. So basically, you're describing what is essentially a natural genetic pattern that is your anatomy. And as far as what our knowledge is to this time, it's limited because we don't generally treat an individual who has no evidence of hair loss but is looking to try to make existing hair somewhat thicker. To answer your question about PRP, PRP is not permanent. PRP does require regular treatment in order to stimulate hair growth. And so that in itself would probably, I would say to you that it's not worth doing. But just for your own education, so you understand the differentiation and where the state of knowledge is. What we do in our practice for both men and women, and we've noticed especially it has been very successful for women who have temporal hair loss, that our treatment of hair regeneration, which we combined a material called extracellular matrix with PRP, and this evolved out of our treatment of hair transplant to actually help the grafts to grow as well as the donor area to heal, that thinning hair became thicker. Well, to make a long story short, starting 7 years ago, we developed a system so that both men and women who are suffering from progressive miniaturization and progressive hair loss were able to reactivate hair that is not growing, as well as strengthen and stimulate the growth of existing hair and induce the shed of thinning hair so thicker hairs will grow in. So in the temporal area, both men and women, we've seen very, very nice results. But the difference here is that those patients were losing hair. Now, we do have young people. In fact, our youngest female pattern hair loss patient is 16 years old, and our youngest male pattern hair loss patient is 17. But I think that in your situation, if you were to even consider doing something, you would be essentially going through areas that we don't have good data for. And I think that I would probably dissuade you because if it's not, I would suggest that it is not cosmetically negatively impactful as you currently appear. And in terms of the expense and the sustainability of whatever treatment is necessary, if you could avoid doing this, then you should probably hold off. I think that when people come to see us and we treat patients from all over the world for both male and female pattern hair loss, and we're dealing with a wide range of people. Essentially, we're dealing with people who are really losing hair and have this type of progression, and the technology does have an effect on hair that's thinning. However, when patients come who say, I have thin hair and I want to make my hair thicker, but they're not thinning, I tell them this is not the right treatment. We can't change genetics. I think it's in a way it's kind of an academic question, and it might actually very well be that you would get some thickening of hairs that are kind of in the intermediate level of caliper, but I just don't think that that would be worthwhile pursuing at this young age. As long as there's no evidence of hair loss in the future, I think that you should probably hold off on any intervention. So I hope that was helpful. I wish you the best of luck, and thank you for your question.